Ever wondered what causes heart attacks? Well, a major contributor is a condition called atherosclerosis. It's a bit of a mouthful, isn't it? But in simple terms, atherosclerosis is the buildup of lipid plaques in our artery walls. These plaques can narrow and restrict blood flow, which can, unfortunately, lead to heart attacks. Understanding the mechanisms of atherosclerosis is like decoding a cryptic puzzle. The more we comprehend, the better we can prevent and manage coronary artery disease, a condition that owes a significant chunk of its existence to atherosclerosis. It's a bit like a villain in a superhero movie, always lurking in the shadows, causing trouble where you least expect it. The coronary arteries, those important highways that supply our hearts with oxygen, can become congested with fatty, cholesterol-filled plaques. When this happens, it's like a traffic jam in your arteries, and let's be honest, no one likes traffic jams, especially not your heart. The process of atherosclerosis starts with the presence of irritants in the blood. High levels of lipids, LDL cholesterol, toxins from cigarette smoking, and hypertension are the usual suspects. They're like the villains in our superhero movie, causing damage and initiating the progression of atherosclerosis. These plaques, these bulges of fat in our arteries, obstruct blood flow. They're made of fibrofatty plaques, forming in the intima of arteries, which can lead to narrowing and even potential clot formation. Think of them as roadblocks in your arteries. The more severe the atherosclerosis, the bigger the roadblock, and the more it can impede blood flow. Now imagine this. A severe atherosclerotic plaque ruptures, forming a thrombus that can block blood flow. It's like a major road accident. Traffic comes to a standstill and the consequences can be serious. So, what causes these plaques to form? What turns these irritants into roadblocks in our arteries? And how can we prevent this from happening? Well, buckle up, because we're about to delve into this in the next part. Now you might be wondering, what leads to the formation of these plaques in the arteries? Well, let's roll up our sleeves and dive right into it. Atherosclerosis, this sneaky culprit behind coronary artery disease, is essentially a buildup of fatty, cholesterol-filled plaques in our arteries. But how does this buildup happen? The process begins with the presence of certain irritants in our blood. These irritants include high levels of lipids, low-density lipoprotein cholesterol, also known as LDL cholesterol, toxins from cigarette smoking, and hypertension or high blood pressure. Imagine these irritants as unwanted guests wreaking havoc in your home. In our bodies, they play a similar role. These irritants begin to damage the endothelial cells, the layer of cells lining the interiors of our arteries. This damage to the endothelial cells sets the stage for the progression of atherosclerosis. It's like setting off a chain reaction of events that lead to the formation of these plaques. Now, as these plaques start to form, they're not content with just being there. They begin to obstruct the blood flow by creating bulges of fat throughout the arteries. This is like having roadblocks set up at various points in your body's highway system. It's not an ideal situation, is it? These plaques are complex structures. They're not just simple accumulations of fat. They involve the formation of fibrofatty plaques in the intima of arteries, the innermost layer of the artery. This can lead to the narrowing of the arteries and potential clot formation. If you think that sounds dangerous, you're right. Severe atherosclerotic plaques can rupture, forming a thrombus, a blood clot that can impede blood flow and lead to serious consequences. So, to sum it all up, these blood irritants, like high levels of lipids, LDL cholesterol, toxins from cigarette smoking, and hypertension, play a significant role in the development of atherosclerosis by damaging the endothelial cells and initiating plaque formation. It's clear that these irritants in the blood play a significant role in the development of atherosclerosis. But how do these plaques affect blood flow? Let's find out. So we understand that irritants in the blood cause plaques to form. But how do these plaques affect our blood flow? As we've learned, atherosclerosis is a process that involves the buildup of plaques in our arteries. These plaques, also known as atheromas, are essentially bulges of fat that take up space within the arterial walls. Over time, they grow larger and larger, progressively narrowing the lumen or the inner space of the artery through which blood flows. This narrowing can restrict the flow of blood to the tissues and organs that the artery supplies. But the story doesn't end there. These plaques aren't just idle obstructions. They're active, dynamic structures that can change over time. Some plaques harden and stabilize, becoming part of the arterial wall. Others, however, remain soft and vulnerable. These are the ones we need to worry about. You see, the outer layer of these soft plaques can rupture, exposing their fatty core to the blood flowing past. When this happens, the body reacts as if there's been an injury. Platelets in the blood swarm to the site of the rupture, sticking to the exposed plaque and to each other. This forms a clot, or thrombus, which can completely block blood flow through the artery. But what happens if a clot forms in an artery that supplies the heart or the brain? Well, this can lead to serious, life-threatening conditions such as a heart attack or stroke. In a matter of moments, a single ruptured plaque can disrupt the supply of oxygen-rich blood to crucial organs, with potentially catastrophic consequences. So plaques don't just obstruct blood flow by physically taking up space, they also increase the risk of clot formation, which can abruptly and completely halt blood flow. It's a double whammy that makes atherosclerosis a major threat to our health. So, now that we know how plaques can affect blood flow, let's differentiate atherosclerosis from arteriosclerosis. Atherosclerosis and arteriosclerosis might sound similar, but they are indeed different. Now let's dive into the nuances of these two terms. Arteriosclerosis is a broad term that refers to the hardening of arteries and a loss of elasticity. This condition can be further divided into three categories: Munkeberg medial calcific sclerosis, atherosclerosis, and arteriolosclerosis. Munkeberg medial calcific sclerosis is a benign condition that involves the calcification or hardening of the artery's middle layer. It does not encroach on the intima or the innermost layer of the arteries, nor does it obstruct the lumen, the central cavity of the arteries. This type of arteriosclerosis is age-related and is more commonly seen in men over 50 years old, affecting larger arteries like the radial artery. The second category, atherosclerosis, is the one we've been discussing so far. It's the dangerous condition that leads to the buildup of lipid plaques in the artery walls. This buildup restricts blood flow, affecting the coronary arteries that supply the heart with oxygen. It's a common cause of heart attacks and is the #1 cause of death in the Western world. The third category of arteriosclerosis is arteriolosclerosis. This primarily affects the intima and is often associated with high blood pressure and diabetes. It is marked by the thickening and hardening of the smaller arteries and arterioles, which can lead to restricted blood flow and damage to the organs that these vessels supply. In essence, while all three conditions involve some degree of hardening or narrowing of the arteries, they differ in the specific layers of the artery they impact, their causes, and their potential consequences. So now we have a clearer understanding of atherosclerosis and arteriosclerosis. But what are the symptoms and risk factors of atherosclerosis? As we transition into the next part of our discussion, we'll delve into these crucial aspects that can help in the early detection and management of atherosclerosis. Now that we've discussed what atherosclerosis is and how it's different from arteriosclerosis, let's talk about its symptoms and risk factors. Atherosclerosis can be a silent disease, often showing no symptoms until a significant blockage occurs. However, when symptoms do present themselves, they can vary depending on which arteries are affected. For instance, atherosclerosis affecting the arteries in the heart could lead to chest pain or a heart attack. If the arteries leading to the brain are affected, symptoms such as sudden numbness or weakness in the arms or legs, difficulty speaking or slurred speech, temporary loss of vision in one eye, or drooping muscles in your face could be experienced. These are symptoms of a stroke, and immediate medical attention should be sought. When it comes to risk factors, some are beyond our control, like age and family history. Yet many risk factors can be managed through a healthy lifestyle. High blood pressure, high levels of cholesterol, diabetes, obesity, physical inactivity, and smoking are all risk factors that we can influence. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help manage cholesterol levels and body weight. Regular physical activity, as simple as a brisk walk for 30 minutes a day, can lower blood pressure and improve overall cardiovascular health. If you're a smoker, quitting is the best thing you can do to reduce your risk of atherosclerosis and other heart diseases. For those with diabetes, managing blood sugar levels is crucial. High blood sugar can damage your arteries, making them more susceptible to atherosclerosis. Regular checkups with your healthcare provider can help monitor these levels and adjust your management plan if necessary. Remember, early detection and management of these risk factors can significantly reduce the risk of developing atherosclerosis and its potential complications. It's never too late to start making heart-healthy changes. That's all for today's video. If you found this information helpful, don't forget to subscribe to our channel for more health tips and updates. Hit the subscribe button below and turn on notifications so you never miss out on our latest content. Thanks for watching, and we'll see you in the next one.